District. Proud Chief Executive. Okay. Well, good morning, everybody. I'm here to provide an update of the COVID-19 situation across the Murrumbidgee region this morning. So we have had 5 new cases confirmed for the Hilltops LGA up to 8 p.m. last night, as went out in the media release earlier today. 4 of those are household contacts of previously reported case, and it includes a woman in her 40s and 3 children, and in addition to that, another young teenage girl. It's good news that these are household contacts of a previously reported case. So that's good because we know that these cases are actually all linked. Also good news is that all of these cases are able to isolate now in their home, and they're being cared for by the Murrumbidgee Local Health District. So for the Hilltops region, that brings the number of total cases to 12 in that region. Interestingly enough, 5 of those cases are children, and they're aged between 2 and 18 years. So to help reduce the spread of COVID-19 in the area around Young, as you know, the people are complying with the stay-at-home orders, which commenced at 6 p.m. last Friday. And these orders apply to anybody who have been in the Hilltops LGA, including Young and the surrounding areas, since the 3rd of September. So moving across now to the update for Albury. There were 3 cases reported for the Albury LGA last week, and I'm very pleased to say that there have been no new cases this week from the original ones reported. So that's good news, and that brings the total number of cases in our region now to 15. And the total cases since the beginning of the pandemic, over a year ago now, is 76 for our region, and sadly 1 death that was reported last year. So at the moment we have 5 of those COVID cases being cared for at the Wagga Wagga Base Hospital with our specialist teams there. 1 of those people is in our intensive care unit. All are stable, and the person who's in the intensive care unit is not ventilated. We also have all of the other people being cared for in our hospital in the home, where they have a medical officer and clinicians who are looking after them and supporting them in their home. We also provide supported accommodation for people who don't have an environment at home that's suitable for isolation. Albury LGA also is being wonderful in complying with their stay-at-home orders, which was introduced on the 16th of September for 7 days. And that applies to anyone who was in Albury since the 10th of September. We've had a couple of other exposure sites listed overnight. So one was from Victoria Health. We were notified late yesterday that a person who later tested positive to COVID-19 visited the Cobram Baruga Sports Club in the golf shop only. And that exposure occurred on Friday, the 17th of September, between 11:20 and 11:50. So anyone who visited that venue at that time is now listed as a casual contact, and we ask that they get tested immediately and isolate until they get a negative result. And the testing is available just over the bridge in Cobram, where they've got a number of testing venues available. Also yesterday, New South Wales Health advised us that a person who later tested positive to COVID-19 had also visited Burrawa. And the venue there is the Burrawa Top Pub, and the person was there on Saturday, the 11th of September, between 11 a.m. and 12:30. That person is now isolating, but anyone who was in that pub at that time is now considered a close contact. They must get tested and they must isolate for 14 days, irregardless of the result. So we do see some essential workers, such as in this case, travelling through our region. They are on what we call surveillance testing, and that means that they're required to have tests every 3 days, and sometimes we get that little bit of a delay if they're having their tests a little bit after the time when they've been to our region. I guess freight workers and essential workers are working under permits to be able to work in our region. So for Young, with those 5 new cases, there were 4 new venues of concern that were uploaded onto the New South Wales Health website last evening. They include the MediCirc GP clinic, the Woolworths, Big W and Aldi, and there are some revised times that have been posted on the website there this morning. Also of concern in our region is positive sewerage testing. So we know that the sewerage surveillance program is a really fantastic early warning program to give us a bit of an early start that there may be people who have either travelled through the region or people in the town who are COVID positive. So it gives us that head start. We've got 3 positive sewerage test results in our region. Obviously Young we know, Albury we know, but concerningly Griffith has come up over the weekend and we've retested all of those sites and many others across our region. We tend to also test in the towns and councils around where we get positive sewerage. So we will be receiving those results hopefully tomorrow, and we'll certainly let people know. What's really important though for people in that Griffith region is that they come forward for testing. And I want to come to testing because testing is, again, the most critical thing that we can do to slow the spread of the disease in our region. So we stood here about 6 months ago saying we had no COVID-19 in our region, but we expected it to come. Now it's all about 2 things: getting our double vaccination rates up as high as we can so we minimise the impact of the disease in our communities, particularly our vulnerable people, and also to slow the spread by getting testing undertaken. And if I could say that the Hilltops LGA have been an exemplar in their response to testing. We saw nearly 1,000 people turn up to testing clinics in Young and also in the towns around Young on Saturday, 500 on Sunday and nearly 700 yesterday, which is extraordinary. And it's really important that we provide lots of testing options for people who may not have transport. So we're also testing in the hospitals around Young, Harden, Burrawa, Cootamundra. Nearly 100 people showed up just to Cootamundra alone yesterday. So that's really, really good news for the Hilltops LGA. And also Albury have been fantastic in their response to testing as well, with a number of options available in that LGA. So now we're really going to focus on Griffith, and tomorrow we'll release some information about some surveillance testing that we'll do for people in that Griffith region, and we'll provide those details tomorrow. Our vaccination numbers have also been really extraordinary. We did the highest number of vaccines in 1 week last week as we start to get more supply of Pfizer vaccine to our state-run vaccination clinics. We did close to 3,000 vaccines across the region last week, 2,940. And so far since March, we have delivered 41,788 jabs into people's arms across our region. And for state-run clinics, we tend to go to places where there is less access through GPs and pharmacy. But we do have our static clinics to help boost the larger population areas, such as Wagga Wagga, Griffith, Young and Deniliquin. We're in Deniliquin this week. There's some improvement that we could see to the vaccination rates in that region, and we are doing a vulnerable Super Saturday population walk-in clinic on Saturday in Deniliquin, and that's a walk-in clinic that will operate and be given priority to Aboriginal Torres Strait Islander people. So I really want to encourage people to do both testing and vaccination, and that's the best way that we can minimise the impact of COVID-19 pandemic across our region. So with that, I'll hand over now to Steph Cook for her update. Thank you.
Thanks, Jill. Well, thank you and good morning, and what a wonderful update, that very comprehensive update that Jill Ludford from the Murrumbidgee Local Health District has provided us with this morning. And I think it's very timely and appropriate that I say thank you to each and every one of our health workers and the other agencies who are all pulling together so well at this time to make sure that there is a lot of testing available to us, to provide support and care and assistance to those who need it at this time. It is a concerning time for our communities, particularly the local government area of Hilltops, and whilst not in the Murrumbidgee local health district, the Cowra local government area just to the north of Hilltops, which went into stay-at-home orders yesterday afternoon following a positive case there. So our electorate, for the first time, is seeing Delta appear in its communities. 12 new cases in recent days, plus an additional 2 now in Cowra. So this is a time when our communities need to pull together, and I have every confidence that they will do that. I have evidence that they are doing it and will continue to do so. Jill Ludford mentioned some of those testing numbers. If you include the GP-led respiratory clinics and the testing that's occurring in Cowra, we've seen over 4,000 people get tested in the Cootamundra electorate since last Friday, which is incredible. And can I say, in all sincerity, thank you to every single person who has stepped forward for testing over that time, and there's been some people that have stepped forward more than once, and that's really, really good. It's really pleasing and heartening to see. Testing is our best way of detecting whether we do have disease in our community, and there's never been a more important time than now. So my message to the community over the days ahead, particularly as potentially fatigue sets in, we need to be ever vigilant. We've got stay-at-home orders, of course, in place at Hilltops. Our communities and our LGAs, our towns and villages, they're all highly connected. So if you're coming from an area that's not under a stay-at-home order into the Hilltops area, please be very, very vigilant about how you're conducting yourself with that travel. If it's for work or other purposes, then you too will be the subject of that stay-at-home order when you return to your own community. If you're travelling, of course, for medical or vaccination purposes into the Hilltops, there are exemptions available for you. But I would just encourage people just right across the region to be very mindful of the reasons that they're travelling at the moment. If people can just pull back a bit on the reasons for moving around our regions, then I think we've got a really, really good chance of stopping the spread both in Hilltops itself and of course, and most importantly, beyond the Hilltops into some of those smaller LGAs. So please keep coming forward for testing. Even if you've been tested in the past few days and you've received a negative result, if you have any reason or even the mildest of symptoms, any reason to believe that perhaps you may have come into contact with someone or been in a venue that has been listed as a venue of concern, please step forward again for testing. One negative test may not be enough under the circumstances to truly determine the level of disease in our community, and we just need to get on top of it, stay on top of it, and ensure that the spread doesn't go any further. Secondly, in relation to vaccine and vaccination numbers across the Cootamundra electorate, today we heard the announcement by the Health Minister that first dose in New South Wales was sitting at 82%, and I'm very pleased to report that 7 of the 9 local government areas in the Cootamundra electorate have equalled or exceeded that first dose of 82%. So to people right across my small communities, thank you so much for taking up the challenge and for getting that first jab. In relation to the second jab, where the state average is sitting at around about 52 and a half, 5 of our 9 LGAs have either reached or exceeded those second dose rates. Again, that's extremely pleasing. And so now the challenge is that we must push on over the weeks ahead. We have a window and we really, really need to make sure that we keep up to where the city areas are up to in relation to these vaccination rates and with our state average more broadly. So if you haven't already booked your first or second vaccination, please make that a priority, not just for the sake of your own health and that of your family, but for our communities more broadly. I've stood here many times throughout the duration of this pandemic saying that our communities, our small communities, are vulnerable. They are largely ageing populations, people with underlying health conditions, and a number of our communities with some vulnerable populations, including Aboriginal and Torres Strait Islander people. And it's really important that we continue to really pull together and make sure that we look after the health and well-being of each and every person in our community. And there's more ways than ever now to get a vaccination. So on that note, I'll finish up and pass back to Jill for any questions that you have. But really and truly, the key messages from me today are, number one, keep coming forward for testing. I'm really proud of where we're at in terms of our testing numbers. And please step forward for vaccination, and we'll most certainly get through this in one piece. Thank you.
Thanks. I might also just add that we're also looking forward to the announcement of the Moderna vaccine being made available through pharmacies. And I understand that a good proportion of that vaccine will be available in rural and regional pharmacies in New South Wales. So we really look forward to that. The vaccine's arrived in the country and is being dispersed as we speak. So that's going to really give us another opportunity to further increase access to vaccination. And I'd really encourage anybody with children over the age of 12. Vaccination is now open to everybody over the age of 12. And we've really got to focus on getting those little people down to the chemist, GP, or to the state clinics and get them vaccinated as quickly as we possibly can. As we saw in the numbers today, we've got quite a high proportion of children who are catching COVID-19 and they can become very, very ill, particularly the little ones. So let's all get those children vaccinated, and a big push for our high school students as well. Happy to take questions.
You mentioned the little ones. Obviously, we're aware there is a 2-year-old girl who's sick with that. She can't get vaccinated. What are health authorities noticing, I guess, with this effect on children who are under 12?
Yes, well, we're very fortunate to have an established paediatric hospital in the home in the Murrumbidgee region, and we have some great paediatricians who have done a lot of work in understanding the impact of COVID-19 on children. The impact is variable. For the Delta variant, little children can become very ill, but in the majority of cases, they don't have such a devastating impact as it does on older adults. So our children at the moment are stable, which is good news. We'll be closely monitoring them.
Can you kind of flesh out a little bit of that care in the home? We've got 7 people being cared for. I guess how frequently are they checked up on? What are they actually receiving as far as care? Because I imagine as it spreads, we'll see more people getting looked after at their houses.
Yes, and look, when we talk about caring for people in the home, we actually call, instead of hospital in the home, we call it care in the home. Because when you're isolating, there's a lot more to your care than just the physical care. So we've taken a holistic approach. Welfare and social needs, mental health needs are just as important as the clinical needs. It's really variable, the impact of COVID. Some people, we've got one gentleman who is relatively asymptomatic. He's busting, to get out of isolation, go back to work, but we have to keep them in isolation so that they don't further spread the disease. We have other people who, feel very, very unwell, and in the Murrumbidgee region, our people are all overseen by what we call a COVID physician, which is a specialist respiratory physician who have developed up the model for our hospital in the home, and we monitor their oxygen levels with a pulse oximeter and their temperature every day, and they're able to call somebody if they're not feeling well. The other half of it, of course, is their social wellbeing needs, and we need to make sure that they've got things like food. If they've got children, how are we caring for children? And so sometimes we actually have to admit people to hospital because they're unable to care for their children, and we take the children with them and we look after the children. So we almost have a home in the hospital for the children while we're caring for the adults. And that's the case in one of our families that we have at the moment. So it's really complex, and we've diverted quite a lot of our staff who already work in hospital in the home and then also community nursing into this area. And we're able to flex it up to look after lots of people who have COVID-19 in their homes.
Just wanted to ask a question about Deniliquin. You said that there's going to be a bit of a push there to get the vaccination rates up. Can you tell me about why that's necessary, why the MLHD is really targeting that Edward River Council area, and I presume it has something to do with the disparate vaccination rates across the MLHD area, and also what you're hoping to achieve out of this week's activities?
Yeah, so thank you. So look, a lot of our vaccination rates are really to do with the geography of a particular area. And of course, as we know, Edward River is quite a large population, but it is a big dispersed geographical area. So that makes it harder for people to access vaccination. So it's about how we can also assist in making it easier for people to have vaccination. We've got wonderful GPs in Deniliquin who are doing an absolutely amazing job, working many, many hours providing vaccination for the people of the region. But we thought by having a walk-in clinic and having it at a time on a Saturday when people aren't working, that we might also attract some of those people who aren't able to get to a routine clinic. So it is a big, diverse geographical area, and we have also done pop-up clinics in other places where it's harder for people to access some of the cities. So we'll continue to support the Deniliquin region, and now that we have also got that Moderna vaccine coming in, and again the chemist and the pharmacies in Deniliquin are really helping with the vaccination rates. So we're there this week, and we have our pop-up clinic on Saturday morning, so we really encourage people to wake up, have their breakfast and come in and get your jab.
I just wondered, has it been concerning the MLHD over tracking all of the data over the last couple of weeks, months, looking at LGAs across the state, that Edward River has been so low in that sort of race to, it hasn't moved around that lower end of the spectrum, and is that something that this is in response to that vaccination data, that Edward River Council has been pretty much the lowest vaccinated rate across New South Wales?
Well, I think the Edward River actually started off by having really great results earlier on. I think probably what's happened is that other places have really accelerated their uptake, so we just need to accelerate the uptake in the Edward River area. The council are absolutely fantastic. They're working really hard to do promotion and really getting people to come forward. I think we really need to promote the second jab. Having second jab clinics is really important. One dose of the vaccine will do some good, but we really need to get that second dose, and that's where we want to focus in the Edward River. Get that second dose clinics happening and get people fully vaccinated in that region. And I understand that there's been great work in the Kumagundra area as well, offering vaccination down along the river there.
Also wanted to ask you on vaccination rates. Do you have the numbers for the current vaccination rates of MLHD staff and healthcare workers in the district?
So we report staff vaccination rates by rural local health districts, and there's been a really great improvement actually in the rural local health district rates. So we're sitting now at 82% of all of our workforce. It's not just doctors and nurses and allied health, it's everyone vaccinated, and 78% are fully vaccinated, and that's really risen up in the last couple of weeks at a really great and pleasing rate. We have all 100% of our aged care workforce now fully vaccinated in all of our multi-purpose services, 16 multi-purpose services and 4 Commonwealth-funded aged care services all have 100% of their staff vaccinated. So we want to thank the doctors and the nurses for coming forward and all of our health staff. They have been given a priority from day one in our vaccination clinics to get them done, along with the paramedics and along with all of the essential services, police and others in an attempt to get everybody vaccinated quickly.
Just
Yep.
wanted to check, when you say all of the workforce, that number at 82%, that's all of the MLHD's workforce?
So that's in the rural local health districts. So that includes
So
Western New South
that's-
Wales.
yeah,
Yes.
all right.
Yep.
And I suppose looking at a deadline of the requirement of the public health order for healthcare workers to be vaccinated, are you confident that you will be able to get to 100% for that first dose requirement at the end of the month?
So the public health order says that every healthcare worker in the state must be vaccinated and have their first dose by the 30th of September and be fully vaccinated by the end of October. And it's very, very pleasing to see the results that we've had. And for people who choose not to get vaccinated, they can't work in the private sector either, because licensed private health providers also have to comply with the same order. So for me, it's all about looking after yourself, looking after your family, and looking after your community. And we have an obligation to keep people safe if we're caring for them. So I'm confident that we will get to the rate that we need to.
Have we found out yet where the man in Yong contracted COVID from?
So our public health unit are doing a lot of really great detective work in looking to see if they can use some of their scientific evidence to find the index case, as we call it. So they're making progress, but they'll probably make some further announcements about that at a later time.
Jill, just on Albury, with them, they've had 3 cases, they haven't had any more. Are they looking almost in the clear now? Are you feeling positive about that, or are you still concerned there might still be people out there?
Well, for people who are in isolation, we do repeat testing. And so we never say we're out of the woods until people have had their clearance testing. And so that people will require to be tested right up to day 13 of their illness. So we're not out of the woods yet, but I guess the results so far are promising.
And just quickly on rapid antigen testing is going to be coming in for a lot of places. I know the greyhounds are starting at that sort of thing. Will that work through the local health district, or do you know how that's going to come into effect at all? All businesses will be accessing it?
Yes, so as you know, we have our laboratory here at Wagga Base Hospital and also at Griffith Base Hospital that do the swab, the PCR as we call it. The rapid antigen testing does not need to go through that laboratory. It gives you results independently to that. And it's great to see many of our industry partners coming forward and using rapid antigen testing to make sure that they can get instant results to clear their workers so that it won't have an impact on our laboratories.
So is that accessible through the hospital network, or where should they be?
No, so
advised?
they are therapeutic good, authority approved, and they can be purchased commercially. Yeah.
And so with those 3 cases in Albury, are they all under the Care at Home scheme? And do we have any update on what sort of condition those 3 in Albury are in at the moment?
So one of the cases from the Albury LGA is actually in Melbourne, has been transferred for care in Melbourne at a hospital there. 2 of them remain in care through the hospital and the home that's provided through Albury Wodonga Health, and their conditions are stable. Yep.
And I don't know if you've seen that about 23 hours ago, Wagga's Hot Bakery was re-added to the exposure list from New South Wales Health. Do you have any idea about that? Is that just an error on their end?
I'll have to look into that. There haven't been any additional exposure sites added to Wagga that I am aware of, so we'll have a look into that. Thank you.
I had a question for Steph.
Sure.
So you're urging people to consider their need to travel around the region.
Yeah.
Just wondered if you could outline the essential travel. Did you think it was essential to travel here for this press conference out of the lockdown area to a non-lockdown area and back? Just
Sure.
I'm sure people are interested in
Yeah.
Thanks.
It's really important for me that I reach people through whatever channels I have. I work really hard as a local MP, I think, as most people recognise, and it's a difficult time for people. Not everybody accesses social media, and in fact we've had a lot of calls into my office to say they'd like to see more of me either in print or on television or on radio, because they don't have a Facebook account. More people have, I think, email addresses these days than potentially look at Facebook. When I'm travelling, there's a couple of things. Number one, I go to the venue that I need to do my work at and I return home. I'm very, very conscious of my own movements. I always wear a mask. I'd like to think that I abide by the health orders at all stages. But there's never been a more important time, I believe, than for me to stand with my communities, for my communities to know that I have their back, that I'm working very, very closely with our health officials in any capacity that I possibly can. I'm doing my very best to communicate with my communities through every possible channel. And we've seen over recent times, and I think the COVID pandemic is one of the sad implications of the pandemic, has been the reduction of the number of news outlets, particularly in small communities. We've seen the Harden-Murrumborough Express, the Junee Southern Cross, the Cootamundra Herald. These newspapers no longer print. And if people can't access that information online, how do they get it? And so I'm very, very conscious at all times of striking that right balance between backing my communities in, getting information out there as best I possibly can, making sure that I'm informed at all times. And, I'm always talking with obviously my mayors and with media as best I can whenever, and I think all of you in the room here today will acknowledge that there's very, very few times that you'll reach out to me that I'm unavailable. I bend over backwards to make sure that I am available for what I describe as those traditional media outlets, because, I acknowledge that, my seat of small communities, a lot of people in our tiny little villages either don't have, they have limited internet access, they might not be on social, they might be very much listening to ABC Riverina, or they watch that 6 o'clock news at night. I'm very, very conscious of that. So I do really, really hard. I tried hard to, I know I'm using a lot of time here to answer your question, but it is something that I think about a lot in terms of striking that right balance between where I go and what I do, and how I make that happen, and how I get a message out there to the community about what the state of play is, what I'm really asking our communities to do, whilst at all times staying within the guidelines of the health orders and really walking the walk and not just talking and expecting people to do other than what I'm doing. So thank you for your question, and it is something that plays on my mind, but for what it's worth, I'm certainly not out in the electorate doing other activities. If you sort of, I'm not out there cutting ribbons or making announcements or anything like that. My whole focus at the moment is certainly to get my two main areas of focus, being Hilltops and Cowra, through this current outbreak that they're experiencing. We're seeing increasing case numbers today. That's the reality of what we're facing. I'm very much hoping that levels off tonight and that we do start to see it, and it was just a little bleep. I'm really hoping for that. But that's only going to happen if the health agencies and our communities really come together, and that they have really good, strong leadership. And that's really what I'm here trying to demonstrate to my communities.
Thanks for that. Yeah, I think it's important that you're here, Steph. I do have a question about, we lifted lockdown, statewide lockdown, and within a week you had 2 LGAs go back into lockdown. Do you think this LGA by LGA thing is working, or do you think it might have been lifted too soon?
No, I think it is working for now. Obviously, in a pandemic where, we're really trying to get better with more information and more evidence over time, so that it's not just a blunt instrument of locking everything down, and particularly when our communities had been in lockdown for a month, when we hadn't had a case for over 500 days. So, and I've still got other 7 of my 9 LGAs are not in lockdown at the moment, and that's really, really good for those communities in terms of their social interactions, their health and well-being, and of course for our small business community. which has, for the last 20 months, it's been really, really difficult for them and for their employees, particularly those in hospitality, tourism, retail. It's been a really, really tough time. I think where possible, communities really should be open and able to interact. I think what's important is what we have done both in Hilltops and in Cowra is to put in place stay-at-home orders when we do have a case emerge, because that allows us to really limit people's movement quickly, so that we can really get an idea of what that community transmission might look like, and that anyone who is positive is therefore in isolation as quickly as possible, limiting the broader community transmission. So I think there is a balance there. I think we've got it right for the moment. I mean, I do appreciate that, for example, Hilltops is a very large LGA, and a lot of those communities, whilst haven't seen a case, we've obviously seen in recent times Burrawa, which is technically out of my electorate but still part of Hilltops. They've had, an exposure site emerge through a completely unrelated situation, and in recent weeks we've seen positive sewage in Harden, although thankfully not at the moment. So there just is that interconnectivity, and Cowra is not much different. It's a sizable LGA, not the same size as Hilltops, but it's got other villages, Wyangla, Woodstock, Goolagong, and those villages are now under stay-at-home orders as well. So really does recognise the interconnectivity of our people within a shire, and we'll just continue to monitor that. I'm having discussions all the time about how long we might be in lockdown for. We will need to see some announcement around that before the end of the week in relation to Hilltops, because it was 7 days up to Friday. So there'll be more to say on that before the end of the week.
That was my next question. Obviously it was a week lockdown, but we haven't seen these cases slow. So when will you be making that decision and an announcement?
They're live discussions at the moment, and my message to the Deputy Premier has been the sooner that we can give people certainty around that, the better. And we'll see what unfolds over the next 24 hours or so.
Awesome. And just my last question is, you had those mobile vaccine rollouts happening in Narrandera and other areas. Have you got more on the cards? Are you happy with how they went, or what are your plans with getting some of your smaller communities vaccinated?
Yeah, look, vaccination is it's a live conversation all the time at the moment, and there's certainly a couple of communities where I'd like to see their vaccination rates higher. Junee remains, top of my list in that respect. And so I'll be certainly doing more work around that with Murrumbidgee Local Health District, the Primary Health Network. I mean, it's really important to remember that, the supply of the vaccine comes from the federal government. We are reliant on them, and Junee has been, a community from the get-go that has struggled to get that constant supply from the feds. And it's all about, ensuring that we do strike that right balance between allowing a very, very good medical practice in Junee, who do a wonderful job at primary care, 365 days of the year. We've got to strike that right balance between allowing them the opportunity to get on and vaccinate everyone versus, the local health district just coming in and doing a pop-up and moving the spotlight away from the medical centre that's doing a wonderful job. So these are ongoing discussions. At the end of the day, there's one thing that, whether it be the medical centre or the Primary Health Network or the Murrumbidgee Local Health District or myself, there's one thing that's an absolute priority, and that's getting people vaccinated. So these are ongoing discussions, and we'll see where they go over the next day and week ahead. Thank you.
Thanks, everybody.
Yeah.